The 1044 is brought to you by Chevron Delo 600 ADF Ultra Low Ash Diesel Engine Oil. It's time to kick some ash.
This week on the 1044, how has the Federal Motor Carrier Safety Administration's Drug and Alcohol Clearinghouse affected fleets and truck drivers since it took effect in January 2020?
Hey everybody, and welcome to the 1044, a weekly webisode from the editors here at CCJ. I'm Jason Cannon, and my co-host on the other side is Matt Cole. FMCSA's Drug and Alcohol Clearinghouse took effect at the beginning of January 2020, and while the regulations regarding drug and alcohol testing of truck drivers didn't really change, the new system streamlined how failed tests are reported and how fleets check drivers' history.
After the hiccups that plagued the clearinghouse in its early days last year due to a flood of new users, the database began working as intended. Since the Clearinghouse website opened for registrations, there have been 2.1 million drivers and organizations registered as of April 1st. I spoke with Jared Rosenthal, the founder and CEO of drug testing consortium Health Street, about what the Clearinghouse has done and the impacts it is having on the trucking industry since it took effect. But before we hear from Jared, I'd like to take a second to tell you about the sponsor of this video, Chevron Lubricants.
Protecting your diesel engine and its after-treatment system has traditionally been a double-edged sword. The same engine oil that is so essential to protecting your engine's internal parts is also responsible for 90% of the ash that is clogging up your DPF and upping your fuel and maintenance costs. Outdated industry thinking still sees a trade-off between engine and emission system protection, and Chevron was tired of it. So they spent a decade of R&D developing a no-compromise formulation. Chevron Lubricants developed a new ultra-low ash diesel engine oil that is specifically designed to combat DPF ash clogging. Delo 600 ADF with OmniMax technology cuts sulfate ash by a whopping 60%, which reduces the rate of DPF clogging and extends DPF service life by 2.5 times. And just think what you can do with all the MPGs you're going to add from cutting your number of regens. But Delo 600 ADF isn't just about after-treatment. It provides complete protection, extending drain intervals by preventing oil breakdown. Before you had to choose between protecting your engine or your after-treatment system, and now you don't. 600 ADF from Delo with OmniMax technology, it's time to kick some ash.
The first thing that people should remember is that the clearinghouse itself didn't actually change any of the rules regarding drug and alcohol testing, right? All it did was, up until now, if you failed a drug test or an alcohol test, it was sort of a self-reporting. Employers had to check with prior employers. Maybe self-reporting is a bad way to describe it. It was that if you applied for another job, you had to say where you used to work, and the employer had to check back 3 years. And there's a lot of faxing prior employers and calling and waiting for reports to come back and paperwork. And, sometimes there was obviously there's an incentive if you're a driver that failed the test 2 years ago, maybe you don't mention that you worked at that last place. So what the clearinghouse really did was just sort of nationalize and unify and standardize the way this was reported. This system is a lot better at making sure that people that are using substances and getting behind the wheel of 26,000 pound plus vehicles are going to remain off the road until they follow the regulations which are in place, which is to get a substance abuse professional evaluation and then go through the process of return to duty testing and follow-up testing for a period of 1 to 5 years. That's the law. It hasn't changed, but now it's a whole lot better and standardized and a lot easier, frankly, for employers to do this process. Didn't change the amount of people using drugs, didn't change the amount of people failing tests, just changed maybe the amount of people that are actually have to follow those rules and comply with it.
While the clearinghouse has been in place for about 1.5 years, there's still some confusion out there about how it works and how it should be used. Carriers are required to look back 3 years through a driver's history, so there's still some manual work carriers have to do when hiring a new driver.
Anytime something is new, there's always some confusion, and it's software and it's government software. So, there's always issues. It's not, designed for maximum optimization, and they don't have competitors which force them to make it super simple. But that said, it is pretty simple. And like I said, once you do it once, you can simply just say, well, Health Street is my TPA or whatever company you're working with. And that's it. You're pretty much done. Now, you have to work with, drug testing companies that have MROs, which of course is the regulation. And then the MRO handles the reporting of positives. And then when you're hiring new people, you have to check back 3 years. Now, one thing I should mention is that the law is 3 years to look back, or the regulation is 3 years. The the clearinghouse has only been around for about 15, 16 months now. Mm-hmm. So you still have to comply, go through and fax prior employers for that period of time prior to when when the clearinghouse started. So we're still kind of walking on a curb here. And, it's surprising to me how much people say it's impacted, because it's really only 15 months of data that we even have in there. Now once 3 years has fully expired since it started, then they will no longer have to check back with prior employers. And then the full impact of the clearinghouse will be evident.
Another source of confusion for carriers, as Jared talks about, is what happens after one of their drivers has a positive drug test.
I think the important thing is that what's true is what's always been true, in that if somebody does fail a test that's working for you, you have to refer them to a substance abuse professional. The MRO has to report it into the clearinghouse, or you have to make sure that's occurred, right? And you want to obviously be sure, because it's still on the companies, right, to ensure that they're complying. They will get audited. They'll be held accountable. So referring to the SAP is important. One thing that smaller companies typically get confused about is whether or not they have to pay for that, whether they have to pay for the return to duty test, whether they have to keep the person on board. And, that hasn't changed. The DOT is silent on all of that. And typically what you see is bigger companies or bigger, fleets, maybe if they have unions, they have negotiated maybe one failure. And if they go through the process, and maybe the company pays for the SAP, maybe they pay for the ongoing testing. Smaller companies have found, obviously, to be more of a burden, because let's face it, if you bring somebody back that has cleared a SAP, meaning substance abuse professional has said, okay, they're ready to go back, but they have to take a return to duty test. And if they pass that, there's ongoing follow-up testing, which is, it's on a random basis, but it's not considered random. It's considered follow-up. And follow-up means it's observed. Somebody has to watch them pee in the cup. And it goes on, could be once a month for up to 5 years. And that's a burden for the employer, because, whether or not they're paying for the test itself, which could be whatever, $79 or whatever the case may be, you got to pull the person off duty. And you're constantly having to manage it and report on it and all that stuff. So it's a burden, and they don't often, want to go through that process.
We've heard for years about the driver shortage and how fleets are struggling to find qualified drivers to fill seats. Jared says the clearinghouse, combined with the pandemic and federal marijuana laws, are making it that much more difficult for carriers.
I have sort of a different take on that in terms of the driver shortage. And my opinion on the driver shortage is that there's a few other major things that are going on at the same time that this clearinghouse rolled out. Obviously, the pandemic hit right at the time that this clearinghouse started. Clearinghouse started January 2020. And the other big thing is, the marijuana laws in this country are changing very significantly, very quickly, and cascading, and sort of exponentially moving very fast. And the federal government still hasn't budged in terms of marijuana as a Schedule I substance, completely illegal, defined as no medicinal purpose whatsoever. Methamphetamine is a Schedule II versus marijuana. So the whole thing is out of whack. And younger people starting to pick careers, right? And we know that the pandemic changed a lot of what younger people are focused on. It's more obvious that desk jobs, maybe are more resilient to things like this. And then there's also this issue of marijuana. So picking a career and say, hey, do I want to go into a job that restricts me from using? I think you're seeing more self-selection for a segment of the population. Not everybody, obviously. And then at the same time, even if you do want to go into driving, there's a huge discrepancy here where the non-DOT drivers are not drug tested. There's no rules. They could be, but it's up to the company, potentially the state. But in general, go work for Amazon, you don't have to get a drug test. So I think there's a big difference there. I think the marijuana rules being divergent between state and fed, and the fact that non-DOT drivers are not tested is a big issue. People are getting the jobs, they're driving, There's plenty of delivery people out there doing Instacart and Amazon and all that. Why aren't they doing the trucks? I don't think the Clearinghouse has had a huge effect on that.
Speaking of marijuana, it has accounted for by far and away the most failed drug tests among truck drivers since the Clearinghouse took effect, with 37,261 positive tests as of April 1st, according to Clearinghouse data. Jared predicts there will be a tool in the near future that will help change federal law when it comes to weed.
I'll give you a firm prediction. I don't know if it'll ever happen, but my prediction is that there's one thing that is going to change for sure. That will change the law for sure. And that is the invention of a so-called weedalizer. So a breathalyzer for marijuana, because nobody is supporting putting truckers on the road that are high. But the problem with this issue, legal or not, is that we don't know based on a drug test if you're high at that moment. Right. So we all agree truckers shouldn't use cocaine or methamphetamine, whether they're driving or not, because it's just, we don't care that much whether you're high at the moment. If you're caught having it in your system, everybody pretty much agrees you still shouldn't be driving a truck. With weed, I don't think there's that agreement anymore with marijuana. So once there's that breathalyzer, just like weedalizer, just like alcohol, we all agree as a society, truckers can have a beer at night and get up in the morning and drive a truck. And once we have a device to test for marijuana the same way, then I think that the law will change.
And that's it for this week's 1044. You can read more on ccjdigital.com. And as always, you can find the 1044 each week on CCJ's YouTube channel. And if you've got questions, comments, criticisms, or feedback, please hit us up at 1044trucking@gmail.com or give us a call at 404-491-1380. And until next week, everybody stay safe.